YouTube, what's happening? Hey, it is Friday afternoon. We're going to talk about COVID and the COVID lockdowns and whether or not these are doing more harm than good. And I'm going to ask you guys because we're going to be live. So hopefully we're going to get some people on the chat. We'll do a little discussion. I have a really cool article I want to talk about where a Stanford professor of medicine wrote about this topic, and I want to talk about that because I kind of sort of have been hinting to this, but I am not as smart as somebody that went to Stanford, so I didn't really articulate it, I think, as good as he did, and I would like to go over that. So let's, you guys, if you're in the chat, let me know that you can hear me and you can see me okay, and then we'll get started once I see you guys in here, because I know a few other times I've had problems with the audio, so we'll try that. Hey, in the meantime, I want to thank you guys for all watching the channel, watching these videos. The channel is sponsored by myself at the moment, so if you are somebody that wants to go into medicine specifically, actually you don't even really have to be going into medicine. If you're somebody in high school or college who's struggling to focus, concentrate, to speed read, to take tests, things like that, I do have a study course. If you can check that out, that helps support the channel so I can buy all this fancy equipment and make a really good channel for you guys. So studyhackers.com, I'll put the link below, but check that out if you can. Cool, you guys let me know if you can hear me okay, you can see me okay, and then we'll start. So, can see and hear you. Awesome. So let's go to this. Let's go to this article here. So this article is was done October 2020. Okay, and this is by Jay. I'm probably gonna butcher your name. Sorry, dude. Bhattacharya, I think. Chira, something like that. Anyway, he's a professor of medicine at Stanford University. He's got an MD and PhD. Whoa, bro. He's also a research associate at National Bureau of Economics Research. He's got a lot of experience in medicine and economics. So basically, this article he wrote, he wanted to go over 4 things. So first, to present the facts about how deadly COVID-19 actually is. Second, to present the facts about who is at risk from COVID, and I've kind of talked about this in other videos. Third, to present some facts on how deadly the widespread lockdowns have been. I've hinted to this. And fourth, to recommend a shift in public policy. So I think that I've hinted to this before, but the lockdowns are causing mass chaos. And essentially what we say in medicine is the treatment should not be more harmful than the disease itself. And I think we're getting to a point that we're understanding what the harm of the virus is and what the harm of the treatment is, which is the lockdowns, the social distancing, the masks, all that stuff. And so this is really articulated much better than I have done in the past. So let's talk about it. So basically the first one is COVID fatality rate. And essentially when we first ran into the virus, we were thinking it's like 3 to 4% of mortality rate. And Jay did some research back in April, and he found that the mortality rate is closer to 0.2 or 0.3%. Essentially, he goes into talking about how they did that, and what it is measuring the seroprevalence, and that is, do people have antibodies or some reaction to the virus in their blood? And for every 1,000 COVID cases they identified in their county, which is Santa Clara County, California, they found there was about 50,000 people who had been infected. And so I had hinted to this early on as well, but I'm not quite as smart as to articulate it and actually do the research. And so what they found was there's 50 times more infections than identified cases. And I think a lot of people were starting to understand that. In the beginning, we didn't know that, and that's fine. I don't think that anybody in the beginning was trying to do anything maliciously, and I still don't think people really try to do things maliciously. But I think we just understand medicine and the virus and the repercussions of all the things we do more as time goes on. And a lot of times I like to take my time and not really make decisions without a lot of information. At the beginning, it's easy to jump to conclusions and say, oh, it's this, it's that, whatever. But just being in medicine for a really long time, I understand that it takes long periods of time to understand these problems deeply. So anyway, when their study came out, it was controversial, but now there are about 82 other similar seroprevalence studies from around the world. The median result of these 82 studies, fatality rate is about 0.2%. So that's very similar to what they found. So I think that in the beginning, we were nervous because we were like, oh man, it's a really high mortality rate. But now we're finding that it's much lower. Who is at risk? And this is what I've talked about before as well. So if we know the mortality rate, and then we know who's at risk, right, that has a higher mortality rate, then we should be protecting those people and not so much the entire population. The single most important fact about the COVID pandemic in terms of deciding how to respond to it on both an individual and a governmental basis is that it is not equally dangerous for everybody, right? This became very clear early on. So essentially what he's saying is there is a 1,000-fold difference between mortality rate in older people, 70 and up, and those in children. Now that's not adults, but that's children. In some sense, this is a great blessing. If it was a disease that killed children preferentially, I for one would not react, would react very differently. So COVID is not deadly for children, but it is deadly for elderly people, specifically those who are over 70. And I talked about actually the Johns Hopkins study where they said really it's elderly, obese patients, hypertension and diabetes are having problems. And there's some other papers to suggest that it's not so much the hypertension and diabetes, but more the obesity, which is the problem, which makes a lot of sense because in our country, we see a lot of these cases where this 42-year-old guy dies from COVID, but dig into it, he's morbidly obese and he had a really difficult time with that. So I think those make a lot of sense. Our obesity rate is 20+%. Our overweight population is 60-something%. Our obese population is 30-something%. Our morbidly obese population is 15-something%. So 15% of 330 million people is a lot of people at high risk. So I think that's important. He doesn't really talk about the obesity so much, but I do think that is another demographic that is at a very high risk. So then the third part is the deadliness of the lockdowns. And the widespread lockdowns have been adopted in response to COVID are unprecedented. Lockdowns have never before been tried as this method of disease control. So basically what he wants to say is the lockdowns are causing more harm than the virus itself, right? What he wants to talk about is in this third portion is how it's these are a couple of the things that are affecting people that are more deadly than the virus itself. So one of the things is the UN has estimated about 130 million additional people will starve this year as a result of economic damage resulting from the lockdown. So 130 million people is more than the fatality of COVID total, right? So that's like a million or something like that in the entire world. 20 years, we've lifted 1 billion people out of poverty, and now we are putting 130 million people into starvation. So that's a problem. Lots of children are not going in for their immunizations because the parents don't want to bring them to a healthcare facility, right? Large number of Americans, even though they had cancer, needed some chemotherapy, didn't come in for treatment because they were more afraid of COVID than the cancer. Mental health problems are in a way most shocking in this. In June of this year, CDC found that 1 in 4 young adults between 18 and 24 have seriously considered suicide. That seems really, really high. I don't know. I would have to dig into that number to kind of believe it. But there's no doubt, I think mental health of the country has taken a big hit. Literally, I did not post anything or do any YouTube videos for 6 months. I stayed in my house. Everybody was pissed off at me if I looked them in the eye because they thought maybe I was going to come within 6 feet of them, right? And you just got this, and everybody felt it. It's like this anger and frustration when you're outside and doing anything, and you're judged for everything that you do and stuff. And for one, I felt terrible, and I didn't want to do anything. I didn't want to do anything fun. I didn't want to go outside. I didn't want to go to work. I didn't want to, talk to anybody. I didn't want to do anything. And so just me feeling that, I can intuitively say that this is probably right. And I'm guessing that ripple effect with everybody else is pretty big, and families are arguing and, upset because of one part of the family wants a quarantine and one doesn't, and these guys can't see them and the kids can't see the grandparents and all these things that are going on. And I think the anger at how how the country's been running it and all these different things, this is a massive problem. And I think the impact of that on the mental health of the country has been staggering and probably immeasurable, whereas the COVID is more measurable. So where do we go from here? And so essentially his group that you can read there at the gbdeclaration.org has written this declaration. As infectious disease epidemiologists, public health scientists, we have grave concerns about the damaging physical and mental health impacts of prevailing COVID-19 policies and recommend an approach we call a focused protection. And this is why I want to talk about this, because this is almost exactly what I was talking about last week in my COVID kind of update, which was when I talked about that Johns Hopkins article. It's like, these are the people that are at high risk. We definitely need to protect them and do things to help them and to decrease their morbidity and mortality, no question. However, that's a small percentage of the population, and we have a larger percentage of the population who is suffering based on the measures that we're applying to everybody, right? So I guess, if there's 15% of the population that has hypertension, you don't give a hypertensive medication to everybody, right? So this is sort of, not a great analogy, but sort of, right? Keeping these measures in place until a vaccine is available will cause irreparable damage, with the underprivileged disproportionately harmed. I do believe that is true. Fortunately, understanding the virus is growing, and like I said, as you know more about the virus, then you can adjust. We know that vulnerability to death from COVID-19 is more than 1,000-fold higher in the old than the young. In children, for children, COVID-19 is less dangerous than many other harms, including influenza. So they go on to essentially say that we need to protect a certain population, but the rest of the population needs to get back to normal as soon as possible, because the longer we wait, the more damage it's going to do to this population. And like I said in the beginning, essentially what this group is saying is that the treatment, at this point, we're realizing the treatment is probably worse than the disease itself for the majority of the population. They are recommending that we keep those high-risk patients protected with social distancing, masks, quarantine, things like that, but not the rest of the population. So at this point, I just want to go to the chat and see if you guys agree or what you think about this article. I definitely agree with this article. I really like their approach. I think it's a reasonable thing to do to protect the people that are at high risk and let the other people do what they're going to do. So let's see on the chat if you guys are talking about anything. So refreshing. We have several effective vaccines for COVID, but still not using them. I don't know that. I know they're being tested for sure, and it seems that they're effective, but you have to test these, and you can't just like explode these vaccinations. And I was doing some research for this, and I was going to do a vaccination video. And one of the problems with I believe it was a polio vaccination, was that it caused Guillain-Barré syndrome, which is when you become paralyzed, and you can become paralyzed for 2 weeks or become paralyzed for life. And so I don't know about you guys, but I don't want a rushed vaccination that possibly causes Guillain-Barré syndrome in me or anybody else. And so that was a big problem. We need a better treatment plan, 100%. I don't understand how Bill Gates is any sort of authority on this matter. Yeah. Anyway, I'm not going to get into the Bill Gates thing, but anyway, yeah. You guys, awesome. I hope you like this article. What I want to do is share things like this. So if you could share this video with other people who you think may like it or may benefit from it. I just like to get this information out. I think these guys did a great job. And our knowledge is certainly evolving on these subjects, so we have to continually kind of adjust, but I think this is moving in the right direction. So